Hi, I'm Daniela and this is Jocelyn. Thanks for coming to our channel.
In this video, we're going to talk about preeclampsia, what it is, signs to look for, and who's most at risk.
First, let's talk about what preeclampsia is. The most simple way to describe it is a persistent high blood pressure that comes during pregnancy or in postpartum.
The Mayo Clinic also indicates that with preeclampsia, there may be high levels of protein in your urine, which could indicate kidney damage or other signs of organ damage.
Although high blood pressure might not seem like that big of a deal, preeclampsia can be a very serious complication during pregnancy and can be fatal to both mother and baby. The exact cause of preeclampsia likely involves several factors, but experts believe it does originate in the placenta. Early in pregnancy, blood vessels develop to help carry oxygen and blood to the placenta and the babies. But in women with preeclampsia, these blood vessels don't seem to develop properly or work properly.
These problems with how well the blood is circulating in the placenta may lead to that irregular blood pressure in the mom.
So what signs and symptoms indicate preeclampsia? First, it's important to note that preeclampsia usually develops after 20 weeks of pregnancy, and it's usually marked by a high blood pressure and potentially proteinuria,
or high levels of protein in the urine. Some signs you want to look out for with preeclampsia are going to be severe headaches, a change in your vision, whether that's temporary loss of vision, blurred vision, light sensitivity, nausea and vomiting, as well as shortness of breath, and a pain in your belly, under your ribs, up on the right side. Now that you know what preeclampsia is and some signs to look for, it's also important to note that not everyone is at equal risk for preeclampsia. There are certain conditions that may bring higher risk of preeclampsia. Some of these conditions are being pregnant with more than one baby, chronic high blood pressure, having type 1 or type 2 diabetes before pregnancy, kidney disease, autoimmune disorders, IVF or the use of in vitro fertilization, and if you've had preeclampsia in a previous pregnancy, you're more at risk to develop it again.
As you can see, we fall into the higher risk category, being that we are carrying multiples. As well, I have an autoimmune disease. So, this is a common topic we talk about at all of our appointments with our maternal fetal medicine specialist.
It was even recommended that we have a blood pressure monitor at home in case we were ever worried about Daniela.
Our specialist also recommended that I take 2 baby aspirin every evening before bed, which is known to help prevent preeclampsia.
And that started at 12 weeks of pregnancy.
We are very fortunate that at this stage in our pregnancy, we haven't developed any signs or symptoms of preeclampsia. But being over 20 weeks, there's still a risk it can come at any time.
It's also important to note that some doctors may not feel it necessary to bring this up, especially if you don't check one of those predisposed boxes that we mentioned earlier. But that doesn't mean that you shouldn't be aware of this and be mindful of those symptoms.
Something we've recently seen in the news is that Olympic medalist Tori Bowie unfortunately passed away, as well as her unborn daughter, from eclampsia, which is a severe complication of preeclampsia. That just goes to show you that even the healthiest of people can suffer from pregnancy complications. So it's important to always just be aware, check in with your doctor, and make sure that you stay on top of these things.
According to the CDC, preeclampsia happens in about 1 of every 25 pregnancies in the United States. We've linked some more information about this in the description below.
We hope that this video brings more clarity and awareness to anyone who's looking to learn more about preeclampsia.
If you found this information useful, please be sure to like and subscribe.
See you soon.